Hydrocodone is an opioid agonist used as an analgesic and antitussive agent. In this video, let's find. What is hydrocodone? What is hydrocodone used for? Contraindication. What are the side effects of taking hydrocodone? How does hydrocodone work? How to use hydrocodone? What is hydrocodone? Hydrocodone, also known as dihydrocodeinone, is an opioid used to treat pain and as a cough suppressant. It is taken by mouth. Hydrocodone was patented in 1923, while the long-acting formulation was approved for medical use in the United States in 2013. It is most commonly prescribed in the United States, which consumed 99% of the worldwide supply as of 2010. In 2018, it was the 402nd most commonly prescribed medication in the United States, with more than 400,000 prescriptions. Hydrocodone is an opioid agonist used as an analgesic and antitussive agent. In this video, let's find. What is hydrocodone? What is hydrocodone used for? Contraindication. What are the side effects of taking hydrocodone? How does hydrocodone work? How to use hydrocodone? Contraindication. Contraindications to hydrocodone/acetaminophen include patients with severe respiratory depression, acute or significant bronchial asthma, gastrointestinal obstruction, and anaphylactic reactions due to components of the formula. Hydrocodone is an opioid agonist used as an analgesic and antitussive agent. In this video, let's find. What is hydrocodone? What is hydrocodone used for? Contraindication. What are the side effects of taking hydrocodone? How does hydrocodone work? How to use hydrocodone? Contraindication. Contraindications to hydrocodone/acetaminophen include patients with severe respiratory depression, acute or significant bronchial asthma, gastrointestinal obstruction, and anaphylactic reactions due to components of the formula. Mechanism of action. Hydrocodone binds to the mu-opioid receptor, MOR, with the highest affinity, followed by the delta opioid receptors, DOR. Hydrocodone's agonist effect at the MOR is considered to contribute the most to its analgesic effects. Both MOR and DOR are GI-coupled and produces its signal through activation of inward rectifier potassium, GIRK, channels, inhibition of voltage-gated calcium channel opening, and decreased adenylyl cyclase activity. In the dorsal horn of the spinal cord, activation of presynaptic MOR on primary afferents, the inhibition of CAM channel opening, and increased activity of GIRK channels hyperpolarizes the neuron and prevents release of neurotransmitters. Postsynaptic MOR can also prevent activation of neurons by glutamate through the aforementioned mechanisms. Hydrocodone can also produce several actions in the brain similarly to other opioids. Activation of MOR in the periaqueductal gray, PAG, inhibits the GABergic tone on medullospinal neurons. This allows these neurons, which project to the dorsal horn of the spinal cord, to suppress pain signaling in secondary afferents by activating inhibitory interneurons. Can also inhibit GABergic neurons in the ventral tegmental area, removing the inhibitory tone on dopaminergic neurons in the nucleus accumbens and contributing to the activation of the brain's reward and addiction pathway. The inhibitory action or MOR likely contributes to respiratory depression, sedation, and suppression of the cough reflex. Activation of DOR may contribute to analgesia through the above mechanisms, but has not been well studied. Half-life. The half-life of elimination reported for hydrocodone is 7 to 9 H. Dose. Moderate to severe pain. 1 to 2 tablets. 2.5 to 10 mg hydrocodone, 300 to 325 mg acetaminophen, POQ 4-6 HRPRN. Acetaminophen, not to exceed 1 g/dose or 4 g/24 HR hydrocodone, maximum daily dose should not exceed 60 mg per 24 hours. Safety advice. Hydrocodone is considered a Category C medication. This means that either studies on animals have shown that taking the medicine while pregnant can harm the development of the baby, but there are no studies on humans. That's all the information about hydrocodone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.